Brian is here to talk about cholera.
Cholera is a bacterial infection. It is caused by drinking water contaminated with Vibrio cholerae bacteria, or by eating food that has been in contact with contaminated water. Because of the improvements in sanitation and water hygiene over the last 100 years or so, cholera has been wiped out in England and much of the rest of the world. There has not been a case of cholera in England since 1893. All reported cases of cholera in England are as a result of people catching the infection while traveling abroad. Around 3/4 of people who are exposed to cholera bacteria do not develop any symptoms. However, these people can contaminate water by passing stools that contain bacteria into water, or pass on the disease through poor food hygiene. The most common symptoms of cholera are extensive, watery diarrhea, nausea and vomiting, muscle cramps. Left untreated, the combination of diarrhea and vomiting can cause a person to quickly become dehydrated and go into shock. In the most severe cases, these conditions can be fatal. There is a vaccination available to protect you against cholera. The cholera vaccination is not recommended for all travelers. For most people, following normal food and water hygiene precautions will be enough to prevent infection. Cholera vaccination is recommended for aid workers helping in disaster areas or refugee camps, backpackers heading to remote areas where cholera is a risk and no medical care access. The cholera vaccine should be available on the NHS, but this can vary. It is also available through private prescription from a private travel clinic. For adults and children over the age of 6, 2 doses of the vaccine are needed to protect against cholera for 2 years. After this, a booster is required. The vaccine is taken by mouth in liquid form. Children aged 2 to 6 years old will need to have 3 doses of the vaccine. This will protect them for 6 months, after which time they will need to have a booster. For all age groups, the doses must be given at least 1 week apart, but no more than 6 weeks apart. The vaccinations should be completed at least 1 week before traveling. The cholera vaccine cannot be given to children under 2 years of age. After having the cholera vaccine, up to 1% of people may have symptoms similar to a mild stomach upset, such as abdominal pain, nausea, diarrhea. Severe reactions are rare.
Thanks, Brian.